Hi, I'm Dr. Jenna Scare, better known as DocJenFit, and we're gonna go into 5 exercises that I really love when you're having knee pain, especially that recurrent knee pain, chronic knee pain. Now, I did post one on the 5 stretches that I recommend if you have like that acute episode of knee pain. So if you want to, check back on that video so that you can understand what I love for stretching to do, to really support and help to ease that pressure of the knee. But today we're gonna focus on strengthening. So let me know below, have you tried strengthening exercises? Comment and let me know, like this video, and then make sure, don't forget to share it and subscribe so you don't miss out on the future. Okay, so we're gonna go into number 1, which is the wall hip abduction holds. So this is really gonna get that lateral hip support known as your gluteus medius, okay? So that's part of your glute muscle on the side, and it just helps to really support the hip. So especially when people are thinking they have rotated pelvis or uneven hips, this is a great one to do. Of course, we did a podcast on what rotated uneven hips mean. Do you need that adjustment? Does it really matter? So tune into that podcast. That's on the Optimal Body podcast. I'll link that up as well. Okay, so coming down to the side, you want to be about a foot away from the wall, okay? Because what we're going to do is some extension as we lift and abduct, which means coming away from the body to really strengthen this guy. So rather than just doing these and hoping that we kind of get what we want, I'm actually going to have you first draw that rib cage down. So kind of exhale here, draw that rib cage down and keep that belly nice and tight. Okay, so now I'm in really good alignment with my body. Now I'm going to lift and rotate my foot down toward the ground. Okay, now I'm going to try to reach that wall. If it's too far back and you feel like that rib cage has to come out, I want you to scoot closer to the wall. Okay, now what even helps even more is to put a little towel between your heel and the wall so that you make sure you don't drop it. Okay, so here, lifting, rib cage down, press into the wall, big toe down, and then you're just going to lift just slightly and see if you can hold. Now, what I want you to do is really press into the wall. Keep that rib cage down, push into the wall as hard as you can, even harder, rotate that toe down, keep that leg straight. I know there's so much happening right here, but you should really be feeling this glute fire up. So we're getting the glute max, we're getting the glute med, a little bit of that hamstring too at the top. Breathing, holding, pressing. So at least start with 10 to 30 seconds and you're gonna do 5 to 10 of these on each side. These isometric holds really help to get into that glute and hip muscle so the brain and the body goes, oh, that's where I need to be activating when I'm doing squats and lunges. I wanna work from those big muscles rather than relying everything on the quads, okay? So that's the first one that I recommend. Next one I recommend are modified Sissy squats. So these are on your knees here. And what you can put a pillow or something underneath your knees if it's too much pressure. Okay, you want to be comfortable. I like to tuck the toes under because we're going to get into the quads. We are going to put pressure on the quads now. So now we're balancing everything out. We kind of started here. Now we're going to activate the quads before we start standing and doing things a little bit more functionally. Okay. So what we're gonna do is, before we even start, I want you to, again, tuck that tailbone under and squeeze. So you wanna keep these hips really straight throughout. You don't wanna break at the hips at all as you're coming back. So take those hip bones, pull them up toward the rib cage, squeeze those glutes super tight. Arms can go out, and what you're gonna do is you're gonna fall back as much as you feel comfortable with and then come right back up, okay? Try 10 of these and test yourself. You can do it. I've had clients who start very slowly because they just don't feel comfortable putting that kind of pressure on their quads. That is totally okay. Start where you need to, okay? So coming back as far as possible, keeping that hip tucked under and keeping those glutes really tight throughout the entire thing. I know you might feel so comfortable, but go slow, kind of test the range, and then slowly go back and increase that range as tolerable. Again, try about 10 of those. Try only about 2 sets. You don't need a whole lot, especially when it's new in the body. Then we're gonna come up. Next one we're gonna do are staggered stance squats or sagittal plane squats. That just means it's moving in this front and back position. Okay, and what this is great for is it actually helps to increase your ankle mobility as you're doing it. Okay, this is going to increase the tolerance of that knee because we do need to build up the tolerance and load on that knee as well. So I'm going to have my feet hip width apart and I want toe and heel alignment here. Okay, about hip width apart, and now I'm going to take my hips back as my arms come forward. Now, when I go into squat, I don't want to lose this connection from my rib cage to my pelvis, okay? So you want to keep that rib cage down. You can do a breath out as you reach forward. And that kind of locks down that rib cage there. And then we're going to reach those hips back, sit into that ankle. See how low you can go into that ankle and then come right back up. Okay, sitting low into that ankle as much as possible. If that heel starts to lift up, just come right back up. But you should feel that stretch, whether it's in the back or the front of the ankle, a little bit of quad pressure, but you have the other foot in front to kind of support you as well. Okay, again, if we want to get low into squats, we need that ankle mobility. So this is just going to help to build that tolerance on the ankle and the knee. Next one we're gonna do our lateral step down. So I just have a little step stool here that I use at home. And what we're gonna do is we're gonna stand on it and we're gonna try to sit our bottom back without letting these hips move. So let me show you from the side or from the front really quickly, just so you can see what's gonna happen in my hips. So I wanna sit back from my hips and I want to try to see, can I go low, 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 barely touch my heel and then come right back up without doing this, reaching and having my hip fall out to the side. I get a good stretch on my bum, but you can see how that then puts my knee on the inside of my hip, where I then, if I continue that line, that's going to go on the inside of my toe. And if you really translate that to squats, that is what the squat looks like, right? We don't want that in a squat. So what we do want is we want to get that hip to go back, okay? When the hip goes back, that is going to keep that good hip, knee, toe alignment and then coming right back up. And what you should feel is a lot of pressure in that glute because it's stabilizing and keeping you upright. So again, my hip is going to go back. My other hip stays stable and I go as low as I can without that knee coming on the inside and then coming right back up. You do not have to go all the way low. Let me show you from the side. So you're gonna come up, rib cage down, bottom reaches back, back, woo, falling, back, back, back. Try to tap and up. If you cannot get all that way that low, you're just gonna put that hip back, back, back as much as possible and then stand right back up. Go really slow on the way down. It's gonna help to build that strength and control of that hip and hamstring area, that glute, as you're building that strength, okay? You are gonna get in the quad a little bit because it's a single leg squat. However, with the bottom going back, that rib cage staying in place, and that foot control, you're just gonna gain so much awareness and strength around that knee, and it's gonna be so beneficial. Okay, last one is just heels elevated pause squats. So I'm going to actually just fold this up so I have somewhere to put my heels on top of. And now with the heels elevated, it takes my ankle range of motion and mobility kind of out of the question, so I can get a lot lower and I can compress into that knee a lot more. So do not be afraid to go into a deep squat. I've had so many clients where they have knee pain and they've been told they have to squat way back here and their knee cannot go past the toe. That's just not functional. Every time you go downstairs, your knee is going to pass the toe. So I want to encourage you to start moving into it, okay? And this is how we're gonna start. Heels elevated, toes forward. Your knees are always going to follow where your second and third toe is, okay? So knees are gonna follow, and hip bone, tailbone area is just gonna drop straight down, all the way down. And then you'll see you come into this good compression. Now press through those heels that are elevated and come all the way back up. So you don't have to worry about sticking the bottom out, any compression in the hips. The heels elevated really takes that out of the picture completely. So again, arms out, and you're just gonna tailbone straight down. Allow you to kind of ride those heels, compress into those knees, and then press through the heels, and then come all the way back up. Okay, try 5 of those. And if you can, that's when you're then gonna go into a pause. Okay, so we're gonna come down, tailbone toward the floor, hold, and then lower a little bit more, hold, lower until you're gonna almost touch, hold, and then see if you can come back up. Whew, that one gets really tough. But I promise all of these exercises, the more that you work on them, the better it's gonna get, the stronger that you're gonna feel, the more tolerance you're gonna build at that knee. If you like this, make sure to subscribe so you don't miss out on any future exercises and knowledge bombs that I can give you into your body. Comment below, let me know what you feel, try them out, see what you experience with it in your body, and don't forget to like the video and share it with anyone you know who can benefit.